Hi, this is Dr. Jonas, here to review prescriber issues that may come up with the Medicare Bridge Program for weight loss. The program launched July 1st of 2026 and now is underway, and we've seen some issues along the way and want to give some advice. So if you're prescribing the product, some of the problems we've run into is making sure that the patients meet the criteria for the medications. So just as a quick reminder, if the BMI is 35 or higher, the patient qualifies for the medication without any other medical conditions. If the BMI is 30 or higher, the patient will qualify for the medications if they have elevated blood pressure and are on 2 medications, chronic kidney disease, 3A or higher, or congestive heart failure with preserved ejection fraction. If their BMI is 27 or higher, they'll qualify if they're pre-diabetic by the American Diabetes Association criteria, or have had a heart attack or stroke or symptomatic peripheral arterial disease. So that's the criteria for qualification. Make sure they qualify. And by the way, qualifying for this with a BMI of 27 or higher with prediabetes means that the patient, for instance, has an A1C of 5.7 or higher. It doesn't mean that you have to prove it on a blood test that day that you're submitting the prescription. It's something that they may have had over your previous blood test. So you have to think about the criteria that the patient meets and that they've already met it. Another thing that I've seen some prescribers have an issue with is the criteria again, but based on where the patient's on the day you're prescribing it. So you may have had a patient who used a weight loss medication that they bought on their own from one of the pharmacies and paid for it and had great success over a period of time, where right now their BMI may be below the threshold, or their sugar may be below the threshold for criteria to qualify. But when they started the medication that they bought on their own, they qualified, they still qualify. Remember, for the prescribers, the patients qualify for the medication based on where their status was when they started the medication, even if it was a year or two before this bridge program started, and they started taking a weight loss medication at that time. Now remember, if they have moderate or severe sleep apnea or liver fibrosis and qualify for medications through traditional Part D, then they may not qualify for this program as well. So know the criteria, and remember, at any point in time that they qualified for the criteria, they can get the medication again. Also, no filling out prior authorization forms in advance. Let the pharmacy get the prescription, let them run it, make sure that the patients weren't getting this medicine through Medicare Part D and that they're eligible for the Bridge program, and then usually the prior authorization request makes its way to you. We've had cases where it didn't come to our office and we just used the standard CMS form that we've printed out from the CMS website, or we've gone into the Cover My Meds website and found the patient and set up our own authorization and move forward. So remember, the pharmacies have to run it through Part D. Let the authorization request get to you before you fill it out. And also on the prescription, make sure you note Medicare Bridge Program. Some of our pharmacists have made mistakes and have run through Part D first because there could be a time where we didn't indicate on the prescription Medicare Bridge Program. So make sure it says Medicare Bridge. Also, usually try to make sure that it's linked to a diagnosis code that's related to obesity that's probably in your EMR. So these are some of the things from the prescriber's perspective that can make the process go smoother. Fortunately, it seems that we're all getting the hang of this and we're having less problems along the way.